You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veach. I'm your host, and on this program we'll be discussing topics of interest for caregivers of loved ones with dementia. We hope that you will subscribe to the channel and you'll hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new program. And now, this is Once Again. Our guest is Susan Burk. She is the community liaison for Central Wyoming Hospice, and kind of a delicate subject. It can be in there to talking about hospice, end of life care, particularly as it relates to someone with a family whose loved one has been battling dementia. Susan, thanks so much for being with us today. Appreciate it.
Thanks for having me.
Let's start at the beginning. Why would someone call in hospice for their loved one? What would that entail?
Well, the first thing, Scott, and what you just described is what we run into quite a bit because of the word hospice. People have a fear of that. People think of hospice as those nice inpatient homes that we have over by the hospital where people come for the last few days of their life. And that's really not what hospice is at all. Hospice is a philosophy of care. It's a very specialized field of medicine. And people should call because they will have knowledge and they'll have answers. So we often hear, when is the right time to call? The right time to call is when you are thinking about it. The right time to call might be before you need us or long before you need us, just so you have that information and that knowledge and that power at hand. Hospice services can help dementia patients a lot sooner than what they think. We really would like people to call before their loved one is bedbound or unable to talk, because this is, as you know, it's a very long and difficult journey, and you don't have to do it alone. And we can help you with that. You know, the hospice benefit can kick in usually if you're looking at the FAST scale, about the time that your loved one is incontinent of bowel or bladder, or both. And then they're usually hospice appropriate. That doesn't mean that they're going to pass away in the next day or so. The benefit says a doctor would have to say that if the disease follows its natural course, your prognosis is 6 months or less. We all know that prognosis is a weird thing, and especially when it comes to Alzheimer's and other forms of dementia. So people, and we hear stories a lot and see our patients who last beyond that 6 months, and there's a recertification process. So really what we want to be able to help people. You know, we know, as I said, this is a very difficult journey. And if we can help along that and help you with your loved one, we want to be able to do that. So that's why people should give us a call.
Real quick, you mentioned the FAST scale. What is that?
Yes, that is called the Functional Assessment Staging Scale. And it is the scale, if you just hop on Mr. Google and look it up, you know, it'll pop right up for you. It shows the different stages of dementia and how it progresses. And that's another thing that we can do in helping. You know, our staff, our nurses and our aides, they're experts, and we can help you understand what might be coming next so that you don't have to feel alone in trying to figure that out. We can say, look, this is kind of where we are. You know, here's where we are on the scale. And these are the sorts of things that you might expect to see next. And when you start seeing that, then here are some steps that you can take. So that's what the FAST scale is.
You mentioned that people can benefit, a family can benefit from hospice when they're looking for knowledge and answers. What kind of knowledge and what kind of answers are available?
Well, the biggest answer is, what do I do next? Or like I just said, what can I expect? I mean, it's a very difficult place to walk. And even in the support groups that I've been in with you, Scott, and, you know, people who are walking this path have a lot of questions. You know, they say, this is what's happening right now. What might happen next? And that's the kind of knowledge. And the other kind of knowledge that I think is really important, whether or not it's dementia or Alzheimer's or any other sort of, life limiting illness, we're all going to get there at some point. If you know someone who's, uh, not going to end life, that they're going to get out of this whole thing called life alive, I'd like to know that person because they're, pretty
Right.
spectacular. But
Right.
um, we would like to seek to demystify death. It used to be something that occurred in people's homes and houses with their families, and now it tends to occur. We're afraid of it and we push it away, and it happens in hospitals and other settings. We'd like to demystify that so people can understand more about what death is about and what it means and what you can do within the process. The whole thing about hospice is that we seek to give you the best quality of life that you can have in the time that is given to you. So, that's the making every moment count sort of thing. Hospice is different than other fields of medicine in that we have an interdisciplinary team of experts. So we have our physicians, our nurse case managers, our aides, our volunteers, our social workers. We have chaplains, we have bereavement care. Everyone works together in real time to take care of not only the patient, but also the family. And that's another really important aspect of this, I think, especially with cases of dementia. Families need taken care of as well.
Talking about the families, do you ever get contacted directly by the families, or does someone need a physician referral to contact hospice?
Oh, no, anybody can refer to hospice. So the family can call, a friend can call, a pastor can call, the doctor can call, the patient themselves can call.
That actually happens?
Yes, absolutely.
Mm-hmm.
Someone who says, I'm sick and I have this diagnosis and I can see it from here and I want to know what this is all about. So tell me what this hospice thing is all about. So we get calls from all over. You absolutely do not have to have a physician refer you. And a phone call is not a commitment. So if you're looking for information, our team of care coordination nurses they're fabulous at answering those questions. They'll say, okay, tell me what's going on and what does the doctor say? And, we can come out and assess. But that's not a commitment to be on hospice. It's just gathering information. And another big misconception is that people think a hospice is permanent. So if you sign up for a hospice, that's it. And it's not. You can go off and on services. If there's a new treatment that you decide that you want to try, you can sign off of hospice services, you can sign back on. There's no penalty for doing so. So I just think it's really important for people to have that information.
Let's start at the beginning then. If someone calls up hospice and they have inquiries, what's the progression of steps? What happens after that phone call is made?
We send them to our care coordination team, who are more or less the admission nurses. They will answer questions. They will see whether or not the folks want us to come out and assess the patient. So they will assess them and try to determine whether or not they are hospice appropriate. If they're not, then we have another program called Transitions, which is a non-medical program that's free of charge, all volunteer, that we can come out and help with things like grocery shopping or companionship or respite or running errands, that kind of thing. So for people with life-limiting illness, but not necessarily a terminal diagnosis. And we have a number of dementia patients on that. But if they decide that you are hospice appropriate, we contact the doctor because they'll need to sign off. And then there's a whole admission process. And the other thing is that people need to know we can do this in your home. We do this in your home. We can do it in the assisted living, the memory care, wherever it is. Most of our patients are outpatients in their own home. I think 85% is where we run usually. And the rest
where I was
in our
that's
home.
where I was going to go next. I think a lot of times people think about hospice care as being in the hospice house, but you
Oh,
say it's
right.
85%, not
All
that.
right. About 85%, right, are in their own homes. Because this is, you know, this is the journey of the family and the patient. This is not, we don't decide what they want this journey to look like. There are people who want to stay in their homes and they want their lives to end in their homes, you know, where they're comfortable and surrounded by their loved ones. There are other people who do not want to pass away in their home. Perhaps they don't want their family to think about that when they're in the home after they're gone. Then they can come into the hospice home, which is, I stress, a home. It's not like a hospital room. It's not, you know, sanitary white and, you know, a facility looking thing. It's like a suite of rooms. So you have your room and you've got your own bathroom, and it's, you know, in a home-like setting, and there are common rooms for the families and kitchens. And, you know, we want it to be a home-like setting. But no, we take care of patients in their own homes.
I want to talk about that next in just a minute. Our guest is Susan Burk. She is the community liaison for Central Wyoming Hospice. And if you're benefiting, if you are getting in some valuable information, we invite you to subscribe to this channel. And we hope that you'll hit that thumbs up like button. Both of those actions will help our channel to grow and allow us to reach more people. And then also, if you'll tap that notification bell, you'll be alerted each time that we upload a new video. Let's talk a little bit about the hospice house, because you use the term, I've heard you use the term in the past, family friendly. It's
Mm.
designed to be that way, isn't it?
Absolutely. And we actually have two hospice homes. So we have the Clefcorn home, which is off Fenway. And then we have the Chapman home, which is off.
Near the hospital.
Yes, and they're all
Mm.
near the hospital. The whole campus is near the hospital. So, you know, we have, for example, visiting hours. We have people who call up and say, what are the visiting hours I can come and see my dad? You know, so we don't have visiting hours. You come anytime you want to come see your dad. That would be 24/7. If, you know, the only time you can get there is 3 o'clock in the morning, you come ring our bell at 3 o'clock in the morning, we'll let you in to see your dad. That's the that's the way these things go. We want it to be family friendly. We've got places for the kids to play. We have people who bring in their pets, you know, to be with them. We have people right now. I don't know that we've got the kitchens open to the families yet, because, you know, COVID changed a lot of things, although we never shut down and we never disallowed visitors during COVID. But, you know, the common rooms are open. So people can come and they can come and watch TV, and they can come and chat, or they can come and have meetings, or, um, you know, all gather in the rooms. You know, one of the things that touches my heart most is when I go through and try to walk through both homes at least once a day and stick my head in some of the rooms and, you know, say hi to folks. And
Mhm.
when I see a big family gathered in a room, you know, they're all kind of stuffed into the room to be with their loved one, and they are laughing and they're telling stories and they're sharing things. I mean, it really is quite beautiful to to see that. And I feel that in some other circumstances, they, outside of our kind of a setting, they might not be able to have that kind of an experience.
How big an area do you serve, and how many beds are available? How many rooms are available for in the hospice house?
We have 14 suites available between the two houses. We serve all of Natrona and Converse County. We have expanded our services in Converse County. So we have a social worker, a nurse, an aide, and a number of volunteers that live in Douglas. I mean, Douglas is their home. They don't drive from Casper to Douglas.
Mhm.
Douglas is their home, so that we can serve them there. And then we are working right now actively and expanding to other areas of the state that don't have any hospice services.
That was going to be my question. There are some areas that are not currently being served.
Yes, that's exactly right. And that just breaks our hearts. I mean,
Mhm.
people can come to the homes from anywhere in the state. You know, you don't have to be a Natrona County or a Converse County resident to be able to use those homes. So we've had people who have come in from areas that don't have their own hospice service, have stayed in our homes, and their loved ones have stayed at perhaps Masterson Place or a residential hotel, or we've even had people who have come in and stayed at the residential hotel, and then we care for them in the hotel, from other places. But we're trying to look where those holes of service are and expand into those. So that is currently an active process, and hopefully we'll have more to tell you about that soon.
We'll look forward to that. As community liaison, just by that name in your title, you deal with communities. So you're dealing with people all the time. What are some of the misconceptions about hospice that people have?
Oh gosh. Well, there's a lot of them. We've
Mhm.
covered a couple of them. That uh, that people need to come into the homes to be served. That's a common misconception, and they don't, because we have the outpatient. That hospice equals death, and they should be afraid of us. I see people all the time, and they say, "What do you do?" And I said, "Well, I work for Central Wyoming Hospice." They go, "Oh, that must be really hard." Well, it's not, because we're helping people get through this journey. We're helping the families and the patient get through this journey. So for us, hospice is about life. Like I said, living the best life that you can. Another misconception is that, oh, when you go on hospice service, we're going to take away all your medicines. That's not what happens. The nurse case manager will go over the medicines for you, and if medicine that you're taking that's going to make you feel more comfortable, that's having a palliative effect, why would we take that away? So um, that's just not something that we do. Um,
Do you ever, after the fact, after a person has passed, say, gee, I wish we'd known, we could have helped? That's one case. That's a case there where we could have been of help to that family. Does that ever happen?
where we see someone who wasn't on our service, you mean?
Right. Uh-huh.
Oh, I think we all have stories like that to
Yeah.
tell. You
Hmm.
know, um, I can just personally think of several people in this area that I know that have passed, that I wish they had reached out.
Right.
I really wish they had reached out. Just because, but before I started working here, Scott, I was kind of, or before I had those experiences with my own parents, I was the same way. I was like, hospice? Oh no, we're not ready for a hospice.
Right.
Hospice, that
Right.
means you're going to be dead tomorrow, and it's just not what it is. We also, with that interdisciplinary team that takes care of everyone, I wanted to touch on the grief care a little bit, because we do offer grief care to the entire community free of charge, and it doesn't matter if you've been on our service or not. So if you've had a loved one die in another state and you are struggling and you need a little help and guidance, give us a call. There's no charge for it. We have support groups, we have one-on-one sessions, and we have special programs for youth, because kids process and young people process grief a lot differently than the adults. So if you're in a situation where, say that the grandmother has passed, you know, the parents, are already grieving, and they're probably grieving differently than the grandkids. And it's hard for them to maybe help the grandkids work through it, because they're working through their own grief. It gets really complicated. So we can help with that. And we have a kids grief camp, during the summer. Um, and we have
And what
currently,
ages is that for?
oh gosh, I don't have it right in front of me. I want to say 8 to 16, but you can always call. You
Well,
know,
and in the description box below this video, we'll have the link to your organization as well, so
excellent.
people can check that out. You serve all faiths too, and
Absolutely.
even families who without a faith, correct?
Exactly. We meet people where they are. We talk more about spirituality, than any particular religion. And our chaplain and our spiritual volunteers are especially tuned into that. So, certainly our chaplain can come in and help you out and offer a prayer, of whatever you like. But it's also part of our chaplain's um, duty, for lack of a better term, that if they come in and our patient says, hey, I'm Lutheran, I really would like a Lutheran pastor to come and talk to me, then we'll go find them one.
Right.
We have priests that will give last rites. We have people who will talk Buddhism to, whatever it is, it's not up to us to put any kind of spirituality on a patient or a family. And we have families who are divided in their religious beliefs, and we try to sort of find a way to disperse that and unite them in their spirituality. But again, this is the journey that belongs to the patient and to the families, and we meet them where they are. Our mission is to companion the end of life journey with skill and compassion. So we companion, we walk alongside and help where we can.
We've talked a lot about numbers as we kind of wrap things up here. You mentioned you have 14 suites in the two hospice houses. You mentioned that about 85% of those you serve receive care at home. Do you have the numbers, just ballpark figures on how many families you serve during the course of a year?
During the course of a year, I believe it was 420 some last year. I could be mistaken on that, but somewhere between 400 and 500 families that we served over the last year.
So we're talking approximately 10 families a week who can be served by hospice.
Quite a bit. I mean, as of today, yeah, quite a bit.
You've never had to turn anyone away, have you?
No, we don't turn
Right.
folks away. There have been times where the hospice home has been full and they've had to wait to be able to get into the home, but we still can give them hospice services until we can get them into the home. But no, we don't turn people away. We don't turn people away for inability to pay either. We have a process by which people can apply for a reduced rate if there are any fees that apply. And that's one I would leave to call, and the care coordination team will explain that one for you. There are different levels of care.
Sure.
The hospice benefit, if you're an outpatient, the hospice benefit, which is a Medicare benefit, pays for that. There are other fees that might apply if you come into the hospice home, depending on the level of care, but you can apply for reduced rates. We wrote off some $324,000 worth. It's either 24 or 42. It was a lot in charity care last year, because we are a nonprofit organization. We are the largest, the oldest, and the only nonprofit in this area, nonprofit hospice. Our bottom line is the patient and the families. Our bottom line is not shareholders, and it's not CEOs. We exist to take care of people.
Susan, we've covered an awful lot in just a short amount of time. Is there anything that, as we wrap things up, anything that we should have covered and didn't get the chance to?
I just would like to reiterate that that people don't need to be afraid of hospice, and they don't need to be afraid of the word hospice. We're here to help people, and we're here to answer questions. And we love to educate people and try to help them understand what a benefit this is. So I would just encourage people to call. Our number is 577-4832. Give us a call, and if you have any questions at all, we're just happy to answer them for you.
And again, we will have all of the information in the dialogue box below. Susan Burk has been our guest. She is community liaison with Central Wyoming Hospice. Susan, thank you so much for being with us today.
Thank you so much, Scott.
You've been watching once again a YouTube video presentation of the University of Wyoming Center on Aging. We hope, if you haven't done so already, that you'll subscribe to the channel and hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new video. Thanks so much for being with us. I'm Scott Veach. We'll see you again next time.